I can pass it over. I can pass it over to Kate Cruz. Kate, would you like to introduce yourself?
Hi, everybody. I am calling in from the Omega Institute in upstate New York, Hudson Valley. We're a holistic learning center, a convening place for social change makers and thinkers and artists and activists. When I think about let's see the questions you posed, if I could play anything outside with my friends, I would want to go back to my childhood and play red light, green light. It was the best. It makes me think of summer and sunshine. And a project that we worked on collaboratively when I was younger. I think similarly, Ben, I would say my childhood playground is something that me and my parents put together and built ourselves.
Wonderful. Kate, do you want to choose somebody to pass it to?
Sure. How about Erin?
Oh, am I the only Erin in the room today?
I'm hoping, because
that's exciting.
What I chose.
Thank you, Kate. Yeah, I'm Erin from RCC. I work with Ben. I'm the new admin assistant. Well, I guess not so new anymore. But yeah, so I've been around since last October. I'm here to take notes and help support you folks in the work that you do. And let's see, games that I used to play as a kid with my friends. We played a lot of He-Man and She-Ra. Like we'd pretend to be the cartoon characters and we'd get like sticks to like pretend like fight with each other and save the world. So that's in my head. And then like a shared project. I don't know if it was a shared project so much as just on the land that I grew up in, there was this copse of pine trees that were growing so close together that their branches interlaced with each other. So I could crawl underneath these pine tree branches and made like a little hideout area for myself. And I'd invite my friends in sometimes, and we'd sit together and tell stories. And yeah, it's just a great little space. And yeah, my mind is going back there today. So a great shared space. And I'd like to pass it on to Sonia.
Good morning or good afternoon. I'm at Southern Dharma Retreat Center, which is a Buddhist retreat center in the mountains of Western North Carolina, ancestral Cherokee land. And springtime in New York City, which is where I grew up, that would have been just taking a nice bike ride in Central Park. And as far as collaboration, I was just one of my beloved high school teachers recently passed away. He was an astronomy teacher. And I was remembering that a friend of mine, together with me and Mr. Thompson, and pretty much every single member of our senior class was involved in writing and performing an astronomy themed original musical. So, and that was a great joy. I don't think it was really all that much of a pleasure to watch for anyone. It went on for like 4 hours, and it was ultimately about whether the universe was open or closed, but it was a really fun experience. And I remember it with a lot of gratitude and warmth. And I will pass it to Brian.
Hi, sorry for my late arrival. I'm not sure what I'm supposed to answer, but I'm an extrovert. I'll make it up as I go along. What do you have in mind? What should I be responding to?
I can get you up to speed quickly, Brian. Sorry.
Okay.
The name of your retreat center.
Okay.
And if there was a childhood outdoor game that you played in the springtime.
Okay, very good. Okay, Brian Lemoy is my name, and I'm from the Franciscan Center in Tampa, Florida. And childhood outdoor game. Yeah, in the summer we played hide and seek, of course, like everyone. And I think that was the best one because we would play it in the spring when it was still getting dark a little earlier, but we could still be outside because it wasn't so cold. I grew up in Rhode Island in New England, so winter was still an issue. Not so much here in Tampa, but at any rate. And I'm not sure who has gone. So if Ben, can I have you help me
Yeah.
out here?
Yeah, maybe I can chime in. Maybe we can pass it over to Kelly.
Sure. Good afternoon, everyone. I'm Kelly. I'm with A Place to Be Spirituality Center in southeastern Wisconsin. Our work here is really about building bridges between all the different church groups and different spirituality groups in the area. So when I was growing up, we lived in this neighborhood that always had big 4th of July celebrations. And so each family was invited to build a float. And the floats were then, we gathered in the neighborhood center, kind of around the flagpole. And there was a parade that went through the whole town, the whole neighborhood. And then everybody got to vote on their float. And so when you asked that question, that kind of came to mind, that year after year, we would work together. It's one of the few opportunities my family had to come together and work on a common project, and that being the float. And no, I don't remember if we actually won many years in a row. So, but I remember it was, you know, it's just a blast. You know, the party was a lot of fun. And my favorite game, or when I think about getting outside, like we're having beautiful spring weather here. It's going to be 70 degrees in Wisconsin today, which is unheard of, but it's going to be that warm. So when you ask the question of spring day, immediately my mind goes to when we were playing kick the can as kids, and also red light, green light was also one that we did a lot. So thanks. And I'll pass it off to Andreas.
Hi everyone, Andreas here. I'm here in Big Bear Retreat Center up in the mountains of Southern California, where we do get snow. Finally thawing, which is lovely. And we're a retreat center, so we host Buddhist Dharma retreats, as well as social justice groups and nonprofits. And I was trying to think about what I would answer as a childhood game, but I think what really came to mind were just really fun games of freeze tag out in like the open fields or playgrounds as well. And then what also came to mind is my dad's from Greece. And so when I was about 4, one of my earliest memories is we spent like a whole summer there. And so I just had this visual memory of me in the village. My dad's from Crete. Running around with a bunch of kids in the village and having like a grand old time. It's my earliest memory. I have no context to it, but it was kind of like my Greek life for one summer. Yeah, and I can't think of a collaborative project, but I gave 2 games. And I'll pass to Eve.
Thank you, Andres. So my name is Eve. I'm from Elohi Retreat Center in the foothills of North Georgia Appalachian Mountains area. And this is my very first time meeting with you guys. So I just found out about you, and it's just kind of perfect timing. So I'm grateful for this connection, because we've been around since 2016, and my collaborative experience, this is a family business endeavor, and coming from just our hearts, and nobody has had any experience in doing this, but we've been to retreat centers and we believe in the mission. So we're going for it now. We're doing this. I'm like, we need some help and collaboration and figuring out what people do also. So anyway, that's a collaborative feeling event for us, is our family experience in growing this retreat center. We feel like the Southeast is a little underserved. I definitely know Southern Dharma there. So, but then I think I love that you thought about childhood memories during when spring is springing, and freeze tag for sure was a fun game for us. And then also Ghost in the Graveyard. I remember Ghost in the Graveyard. It was more summer when school was out, and the sun didn't go down for a long time, and we got to play a lot longer, and that was back in the days when our parents just had bells to ring and you had to come in. But so Ghost in the Graveyard and freeze tag, those are some really good fun games as a kid. So let's see, I pick Sandy.
Hey everybody, I'm Sandy. I'm sitting in for Christina today from High Hope Ranch. You couldn't make it. We are currently overrun with blue bonnets on the 900 acres at High Hope. which in Texas, it's that spring tradition of plopping your kids down, hoping there's no snakes around, taking pictures and showing that some of our fields look like oceans because they're just completely covered. So we're having a really great year. My childhood games was in Ames, Iowa, and I played pioneer schoolgirl, and I had a little park that had a little creek with a log across it. So I pretend I was having to cross the creek to go to school, and so I discovered that creeks were alive and there was insects and things to watch. So and really any unsupervised playtime as a kid was wonderful spent. Hide and seek was our neighborhood favorite. Collaborative, I wish I had the float story from the family, but biggest collaboration was just now helping Christina transition High Hope from her ownership to nonprofit ownership. And we're not a retreat center in the fact that we organize retreats, but we welcome people to come retreat to High Hope, along with families that come connect to nature and food. And I picked Jamie next.
Thank you. Hi, I'm coming in with reading the prompt in the chat, so thank you, whoever put that there. I grew up in well, first of all, I'm with the Franciscan Sisters of Little Falls, Minnesota. So I'm the programs ministry director. And up to this point in time, retreats have been centered mostly for sisters and people associated with the sisters, and we're expanding. We're in a time of expanding that. We've always welcomed anyone who comes, but now there's a little more attention with that happening with my being here. I think I'm in month 6. I'm in my 6th month here. That's pretty exciting. So I grew up in a military family, so lots of different places with different childhood games, traditions, and things like that. When I lived in California, there was a big orchard in the back and free play, just go out and play together. That was wonderful. Also, at the time when the street lights came on, you better be home. Or when you heard one of the parents calling you, then it was time to go home. And at school, I remember playing red light, green light, and what's the other one? The freeze tag. That was a freeze tag. Oh, Red Rover, Red Rover, Red Rover. So those are 2 fun ones that I remember. So I don't know who to pass it to because I don't know who has been. So if you have not gone, I pass it to you.
Maybe we can pass it over to Ratna.
Hi, hang on, I'm getting a phone call. I have to decline. Hi, I'm Ratna Horjena. I'm with Mount Madonna Center in Central California. We're a retreat and conference center, and we rent the facility to other nonprofits, and we do our own programs, mostly of yoga and Ayurveda. What I was thinking of for childhood in the spring was 3 friends. There were 4 of us that were kind of best friends, and we lived in New Jersey, and we lived near the bay, near Newark Bay, and we'd roam the coastline, and we'd find like pieces of cloth or rocks or an old bottle cap or something, and then we'd make up this whole mystery story about it, like we were the Nancy Drew Club and we were each characters, and we would just figure out what the mystery or what the murder was behind everything that we found on the beach. So that was very collaborative. And I think, like others, the neighborhood, I keep thinking of softball. We used to have neighborhood softball games but it wasn't like high pressure, like all the kids were welcome and we just go out and play and have fun. And it was the same thing, ring the bell, time to come in, just so safe and easy and comfortable. Sounds so different. And I just want to say I have to leave. I'll have another meeting close to 11. So I'm glad this is being recorded. I'm happy to meet everyone, and I'm sorry I'll probably miss the bulk of the discussion that I was hoping for. Thank you. Nice to meet everyone.
Maybe we can go to Lindsay. Okay, yeah, there you go. Lindsay's comments are in the chat, so thank you, Lindsay. Welcome. building forts, a mural collaboration. I got to see one of those earlier this year. Those are so cool to see. I think the person we're missing is Nancy, but there may be someone else I'm missing as well. Nancy, have you gone yet? Okay, if you want, go ahead.
Hi, my name's Nancy, and I'm with Casa Escali, which is just outside of Chicago. And Casa Escali was purchased in 2021. It had been a retreat center since 1957 and was handed off from a group of Catholic sisters to a young Latino community. So after 18 months, about 50% of our programming is for Latinos between the ages of 18 and 25. And then the other 50% is mostly groups that we have served for many years, most of them teenagers. So our demographic is very young. And it's an interesting time in the life of Casa Escali. My memories, I think everything everybody said, I grew up in the 50s, so we played all those games. I lived in a number of different places. So my brother and I would hunt for all different kinds of snakes, depending on what part of the country we were living in at the time. And the only thing that is kind of collaborative and kind of a game would be a little bit too early yet in the year in Michigan or some of the other states that I lived in. But our big excitement was to build tents outside and sleep outside overnight. So we created our own games. There wasn't a whole lot of organized collaboration, but I think we did a lot of things working together. So maybe that was a precursor of my years in retreat work, that I, even at that age, had to build places for people to stay. And also we just walked. I mean, any place there was open space, whatever state I lived in, there was just an enormous amount of time spent outside, just enjoying nature and walking wherever we were. And that was really a gift as well.
This is great. I'm so glad I asked that question. I have such good images in my head from thinking of your childhoods. So thank you for sharing your stories. Yeah, I want to try to carry that with us as I present like slides in a slide deck, which can feel pretty dry. But that idea of opportunity and collaborative relationship, that things are possible on the other side, that maybe we can't see very clearly, but through building these kinds of relationships, more things are possible. So that's the angle that I'm coming at this conversation from. I'll give you another chance to kind of get in the room in terms of how you're coming to the conversation in just a minute. But I wanted to start by giving a little bit of framing around why I thought this would be a good topic for today's call, and a little bit of background about what I've been thinking about the past few months that's new for me around collaboration. And then we can talk about some examples of ways we could work together going forward. So I'm going to jump into a slide presentation here for a second, like this. Can you see that all right? There it is. Aaron, is that coming through for you? Yes, getting a thumbs up. Okay. So I want to talk about some collaborative approaches to fundraising. And I think it's clear that collaboration means working together, and it means there's a lot of different perspectives. So I also want to make sure that this includes multiple approaches, not just one, and that there are different kinds of engagement that could still be considered collaboration that maybe aren't becoming partners and fundraising together side by side. There may be some other ways that folks could collaborate together. And we're open to that. It's not a value judgment. There's a lot of different ways to do this. So today I wanted to talk about what I've been seeing, this sort of new approach to partnerships. I also want to have that chance to get in the room with each other and think about what experience we're all bringing and what we're looking forward to learning with each other. I want to talk a little bit about a spectrum of collaboration, different ways that we can get in with each other, some recent research that I found around funding networks and how we can think of RCC as a network, and then some examples that I've sort of sketched out about what partnership could look like, and we can talk through whether that's relevant or how it might be different with your center at the end. So I'm trying to build us up into a more meaningful discussion at the end. I guess I can jump right into this new approach at RCC with some with some cute puppers carrying a stick together. They know it's springtime. It's time to play outside. As I've been thinking about fundraising for RCC, I've often thought of an approach where RCC sort of solves retreat centers' problems, kind of steps in, gets some funding, presents ideas to retreat centers, and then retreat centers can get on board. Over time, I'm realizing that that's fairly difficult and that it isn't grounded in the retreat center's regions or other needs, skills, identities. And so there's more of a need for clear delineation on partnership before moving into specific fundraising around certain programs, which is not how we've approached it in the past, maybe because we haven't been able to. We've been too busy kind of learning about who we are and what we're doing. So part of the conversation today is around inviting further conversations around one-on-one partnerships between RCC and your center, and being really transparent about that RCC doesn't have all the answers, but we have a lot of ideas and quite a few programs already going. And if your center is also headed in a similar direction, there's an opportunity for us to make an agreement together to pursue funding together. I also want to make it clear that RCC is not a funder. I think that's been kind of murky in the background because we've had such a close relationship with our founding partner, the Fetzer Institute, who funded the first 3 or 4 years of our work together. But there's no guarantee that they're going to keep funding us. And we are steadily searching for more funding as a program to serve this growing network. So in some ways as a network. And our main role is as a convener, as a builder of containers to bring people together to see what's possible. So fundraising together is certainly a viable option. We aren't a funder. We need funds just like everyone else. And doing that together could be a benefit to all three. It could be a benefit to the funder because it allows your program to be scaled in a different way, a benefit to you because it gives you more partners to help you deliver what you want to do, and a benefit to RCC because it helps us get closer to supporting you in the main things that you're working on and shows where there's overlap with your sort of peer centers that are also working on those issues. So the intention is to create mutual benefits all the way around. With that kind of header, we can talk a little bit about who's in the room. I have a poll prepared that I can share with you that just kind of gives us a sense of what experience we already have with fundraising. And when we're imagining collaborating on fundraising, what actually seems doable? Is there sort of a level of engagement that you've already considered? And if it's a pretty low level of engagement, totally fine. Maybe this conversation will give you some ideas for down the road, or maybe it will just help you think about what's possible. And that's okay. I'm not here to kind of push for a certain kind of partnership. I'm more here to make sure that the conversation is broad and that we're all in the room together to see what's possible. So I will stop sharing here for a second and let's do this poll instead. I will jump to this. So it's 3 questions. It should pop up on your screen. First question, what is your level of experience with fundraising? There's several options. Pick whatever feels kind of closest to where you are individually. Second question is around collaborating. What seems most doable for you in terms of your ability to jump in and be with some others to do something together? And then the third question is more around your capacity right now. Like you're interested maybe in something a little bit more difficult, but you don't have as much time available. So welcome all answers. Give another few seconds here for folks to see how they land. Yeah, maybe we can stop there. I got 10 out of 11. I'm going to end the poll and I'll share these results with you so we can all look at them. And maybe Aaron, you can catch a screenshot of this for the folks who are watching at home. Turns out there's a range, which is great. Some folks who are new and some folks who all they do is fundraising. It's awesome. And then quite a few who have a lot of experience with all different kinds, but who carry multiple hats, you know, who are wearing also the director hat or something else. Quite a range on what we're interested in doing together. And 9 out of 10 folks say they're ready to commit to a few hours over a few months to collaborate further around fundraising. A couple people even have a topic in mind. That's great. So this gives us a sense of where we are with each other. We can come back to this. I'll go ahead and stop sharing now. But that gives us a sense of who we are here. This is where I need like 5 screens, not just 2. Any surprises there? Is that kind of what you expected on this call? Like for you, Eve, this is your first community call. How does that feel to see that spread?
I like that. It seems nice to have people interested in this. I'm very new to the fundraising, and that's part of the reason why I'm interested in this. I'm also interested in other collaboration things besides fundraising, like helping with how people find staffing and things like that.
Yeah.
But that's another conversation. We can deal with that later.
Yep, great. Any other comments that people have about the poll? Oh, Brian's back. Okay. I can keep jumping forward here. I have this collaboration spectrum tool that's kind of a helpful way to think about level of engagement and what's possible the more trust we build with each other. So you may have seen this image before. We've used this, I think we used this in our green paper, perhaps. This is really helpful when we're talking about collaboration. It can mean so many different things to different people. And most of them could actually be considered collaboration. On the left side, with a little less trust or alignment or integration between different organizations. This graph is around nonprofit collaboration, so different nonprofits. You might just be learning about what's in the ecosystem. It might just be an overview, who else is out there. But as you build these kinds of relationships, like we're doing in this call today, you're able to move a little more to the right. And actually, I feel that most of RCC's work is kind of in these middle 3. It's around information exchange, peer support, a little bit with joint projects and programs, not a whole lot, perhaps more in the future. And as we build more trust and alignment, I think some bigger things could be possible, but most of what we're doing, if you're looking at community calls, affinity groups, collaboration hubs, those are all around peer support. Retreats of various kinds, I think still mostly fall into peer support. The Racial Healing Initiative, I think, might fall more into joint projects or programs because we're working with individual centers. Land Legacies was an education series we did. I still don't feel that falls into shared support functions. If we're talking about learning about fundraising with peers, sort of like the poll suggested, do you have a few hours to commit to that? That still would fall in information exchange or peer support. So that's all great. Some of what I'm curious to explore, though, is moving even further to the right. May be possible, may not be possible, but how could we collaboratively fundraise as partners and almost to the level of shared support functions where we're getting a little bit more of an inside look at each other's organizations. We're approaching funders together. It's going to require trust that may not be there for a lot of us, but trust that could be there in the future. So it's worth having the conversation. We've asked about this in the past. So this is a community survey we conducted last year. We asked, in what ways can you envision collaborating with other RCC community members in the future? And you'll see the percentages for these different layers And this is also in the same kind of spectrum from less collaborative to more collaborative. And there's fundraising collaboration. So about a third of us were interested in collaborating around fundraising. Sharing information and peer support were the first two. And that's like, the vast majority, 87% interested in sharing information. So I think the key there is that fundraising collaboration is probably not for everyone, and that's totally fine. Sharing information and peer support is for most of us. So there may be an opportunity to move forward with a group that wants to look into that further. And I've been having a couple conversations with Sonia, who's on the call today, who's interested in helping make that possible by facilitating a conversation or two. So there's some wheels turning there. If we want to move that direction, that's an option. If we're interested in going a little further and thinking about collaborating together, I do want to talk a little bit about how I got to that point and some of the research that's out there around funding to networks. So Collective Mind, you'll see this image of their guide to donor funding for networks. This is based on research they did over the last 2 years. It was multi-phase. It engaged both networks and donors. What do donors need? What do networks need? Where do they match up? Where are the challenges? I think for us in RCC, it can be hard to think of ourselves as a network. Network sometimes has kind of a dirty word quality to it. It feels schmoozy or artificial, like you're leveraging relationships for monetary gain or something. And I think at retreat centers, we're more about community or expanding relationships, a web of relationships. And I see them as very similar. This image on the right is from a retreat that we hosted. And those words were words that folks wrote based on their experience of being a part of the steering committee at RCC. And I see that as a network of their vision that's leading us forward. So to me, those two feel very, very aligned. And when I think about funding for RCC as a network, it feels like a way that I can empower each of our centers in some small way for the whole sector to move forward. So it's that field building kind of vision. That's how I come into this, which is a little different than an individual retreat center leader who's trying to fund their organization. What the report showed is that fundraising for a network can be an uphill battle. Maybe not surprising. We all know that networks can be complicated. They take time. Building that trust doesn't happen overnight. They're complex, especially the more decentralized and dispersed. And that's some of the value too. Being decentralized is a sign of health. There's a lot of different movers and shakers. We want that. But that can be hard for funders to understand. How we govern the network is also really key. And that can be hard to delineate who has responsibility over what. And how are we communicating that with each other? The time that we're all available to show up is constantly changing. How we determine whether we're sustainable as a network is hard to see because we're emergent. We're learning as we go. So there is this sort of herding cats quality that's underneath what they're saying. We're all moving in different directions. We have our own goals. Sometimes they overlap with each other. Sometimes they don't. That's okay. But that nature, that emergent nature is part of what makes networks difficult to evaluate and therefore difficult to communicate the value to funders. Donors often will not or cannot provide unrestricted core funding to networks. And networks need that. So how do we solve that problem? How do we find alignment on strategy if funders aren't used to working with networks? Perhaps it's easy to find alignment on values or on the themes of our work, but if a network is international and a funder works within a specific region, it can be challenging to find where we connect. But there's still so much value to what we're doing. Like there's this huge positive side as well, right? That we can create impact at a systems level, that we create value for and through our members, that our collaborative capacity continues to increase. So it's not a done deal, but I think there are other ways to approach it. So if I haven't lost you yet, with all my slides, I have a few more to share, and these will be a little bit more nitty gritty. So these are some examples of how this could work, how it could look for RCC to partner with a retreat center. So if these are the two dogs carrying the stick, what is the stick that we're going to carry together? If Glowing Example Retreat Center wants to work with RCC, what is the thing that's going to bring us together? So here are all the different things that RCC is working on. These green bubbles all represent work that's already in motion at RCC. We have a Catholic Centers Affinity Group. We have a Midwest Centers Affinity Group. We have interest in several conversations going around our retreat centers becoming resilience hubs. We want to become a membership organization. We've been doing a sustainability study looking at business models. We've got a whole racial healing initiative going that includes racial healing workshops, a local facilitators group, a BIPOC people in retreat spaces, affinity group, and all of these have room to grow. So there's lots of different ways that retreat centers could get involved. But it's up to each center to kind of determine what's in their wheelhouse, what's already aligned with what they want to be doing themselves in order for us to become sort of equal partners. And so one example, so I'll just kind of play this one out. Let's say Glowing Example is already participating with the Midwest Centers Affinity Group, and they like those folks and they want to work together on something. They also want to work with chaplains. Maybe they have some programming that's similar. Maybe they do restorative retreats for teachers or clergy or, something similar. If we were to decide that we wanted to work together toward providing restorative retreats for chaplains, and we wanted to get some funding to do that, we could put together an MOU between RCC and this retreat center, and maybe between the retreat center and some other centers in this Midwest Centers cohort, to make it a little more official and determine a little bit tighter scope of what it is that we want to do together. From there, we could connect with a or several chaplaincy associations. I've had some conversations with them. They'd love some support in meeting the needs of hundreds of chaplains who are burned out after the pandemic. But it's hard for us to identify what we're doing if there isn't some on-the-ground capacity already in place. So if I don't know which retreat centers I'm working with, it's hard for me to talk to the Chaplaincy Association about what's possible. But if we make that official, and we have a memorandum of understanding between the Chaplaincy Association and our collaborative partners, we can start reaching out to funders. We could reach out to quite a few funders. Some of those might be faith-based. We're talking about chaplains here. Some of them might be regional. And what I'd been looking at as I was kind of playing this scenario out is that this funding would come to RCC, right? And then we would reach out to retreat centers and say, let's work together. We've got some funding. But what I'm realizing is that that isn't going to be very clear for us, because these funders want to work in a specific region. They want to work with a specific, maybe faith identity or faith community. And maybe they want to serve in a specific way that RCC can't provide. But it doesn't mean that one of our collaborative partners can't provide that. So maybe faith-based funder number one is the same stream of religious tradition as one of the retreat centers in our group. And all of the retreat centers are from a specific region. So we already can reach out to regional funders. And that will make all kinds of new things possible, because we're already kind of narrowed down and aligned in a different way than just an international network trying to get funding for chaplains anywhere, anyhow, which has just been too vague to really narrow in and build a program on. So that's one example. Pretty complicated, a lot of moving parts. We would really have to be clear. We would have to have a lot of clarity of roles and responsibilities in order to move into a partnership like that. So I'm not saying we start there, but I thought it would be better to get that in front of you before showing you something a little easier. So let me show you one more. Here's those happy puppies again, running with the stick. Remember, this can be fun. RCC and a retreat center, all these opportunities. Let's maybe just pick one. So let's say the resilience hubs. We decide to work together. We're not sure if we want to just look at resilience in general, or if we want to start an education series. So maybe through conversation, we're able to narrow that down. We form a specific kind of partnership. We establish a memorandum of understanding between your center and the RCC. And then we decide, you know what, we really want to work on getting your retreat center some solar arrays and learning how to install them. And through your participation, you're going to share out to other retreat centers in RCC about the process, what you've learned, so that other folks are empowered to do the same. So we get that in place and we reach out and we find a funder. The funder, though, let me admit, okay, thank you, Aaron. The funder, though, wouldn't come to RCC again because they only work with Catholic organizations, which RCC is not. So Catholic Energies wants to do this kind of a program. They want to do it with Catholic organizations of all kinds. We have a lot of Catholic centers in the RCC, but because we aren't a Catholic organization, we can't pursue them. And a similar example here with this other grant that came to Congregations Caring for Creation from the Minneapolis Foundation. So if this retreat center was located in Minnesota, and if they worked with Black, Indigenous, and communities of color, they could get some energy efficiency grant money to work on a similar project. So there are different ways this could look depending on your retreat center's identity or what you're working on right now. But it's not funding that RCC could get. So it would have to be in partnership. And then once again, it makes possible these new things. You get to learn about installing the solar array. All that information also Catholic Energies gets to learn about how this works at retreat centers and how many retreat centers there are who maybe could benefit. But also RCC gets to pass this on to our network to say, look at what we're learning about solar arrays and what's possible at retreat centers all over, regardless of their specific identity or region. So it makes me excited. It also makes me a little intimidated. Those kinds of relationships take a lot of care and trust. And as we saw on that spectrum, that takes time. So it's not an easy thing to bite off, but I think it's worth discussing where we are and how that lands with this time and this capacity now at each of our centers. So I'm going to stop my slideshow there and come back to the full group. And curious if we can, I went through that pretty quickly. Okay, it's only 2:20. I tried to go quickly. And we have some new folks. Welcome, Dr. Nancy. Thanks for joining us. I'm wondering if we can chime in a little bit with how this lands, how this matches up. I like that idea of how this matches up with our experience, because I think we're each coming from different roles in our organizations, from different organizations and regions. And maybe this is something that you have a lot of experience with. You've already done this and it's worked really well. Or maybe you have some other experiences that could be cautionary tales that could help us think through what we might want to do together. So I invite kind of some community discussion around that. Anybody have something to chime in with?
Well, I do. Oops. Is it okay if I go?
Yeah, go ahead, Eve.
Okay, so this is all very interesting to me, and I love the idea of collaboration on fundraising and getting ideas. One of the things that we're struggling with, we are a nonprofit retreat center, and people do ask, we try to put out, donate to help support the cause and all of this, and we're starting a scholarship program and trying to get this an affordable place for people to come, because retreats are not cheap and things like that. But some feedback I've gotten is that, why would I donate to you when there's starving people on the street that I could donate to, or something like that? So coming up with the story on how, like, what would make people want to donate. We're not a Catholic center. We're, not a specifically aligned thing to any church or anything like that. So we do, the solar panel thing definitely is interesting to us. We have already started doing that here. But so anyway, I think having the story of really why people would want to donate to you to begin with. And I don't know if people have that, if people have been doing all this grant and fundraising and things, do you guys have a story?
Yep.
Radna, do you want to go next?
Yeah, I'm not exactly addressing that. It's just that I have to leave in a few minutes. So I just wanted to But thank you for that. And I'm just so sorry I won't hear all the discussion because I can see it's going to be really rich. Ben, I love everything that you presented. I am so grateful that you did all that work to create such a rubric and overview. I can say one program we're doing at Mount Madonna this summer as a pilot is burnout for physicians from COVID. And so we've been working on that, and we're also working on some diversity programs. So I think all I can offer before I have to get off is, if there were funders that really wanted to fund something that wasn't in existence, I know that we would love to, we have a lot of innovative programmers who are looking to meet what the world needs, kind of thing. And so I know we'd be happy to, and I'd be happy to spearhead some of that, even for the RCC, to help pull that together. And just feedback, I personally am someone who loves networking and connecting the strengths of the different centers and the different talents with each other. So I'm just really thrilled that you're even considering something like this, because I know how innovative and unique it is. And that's why I love this organization. All right, I have a few more minutes and then I'll be off. Thank you.
Thank you for sharing that. Yeah, great to hear. 1 second, Andreas, and then I'll call on you. I would just respond quickly, Eve, to what you were saying. That's something that's been expressed before in other groups around this need for how do we tell our story? What is our value that we're offering? I will say that RCC has a green paper that we've written that talks a little bit about the value of retreat in general, and that our Catholic Centers Affinity Group is interested in writing another paper specifically about the value of Catholic retreat centers. But there are all other kinds of centers that have very different kinds of impacts in their communities. So definitely worth discussing more. I love the question. I think the green paper is named that because there's always ways to refresh it, kind of an evergreen paper. There's new ways that retreat centers can serve. So yeah, I'll just say that, and then I'll call on Andreas.
Thank you. Thank you. I'll look that up.
Thanks, Ben. This is so well timed. I feel like this is something we're really focusing on at this retreat center and talking about a lot. I mean, so we're a for-profit retreat center. So really, it's a different lens that we're looking at and more kind of convening in a lot of ways. And we've been kind of exploring this a lot, but, we've been starting to connect with a lot of nonprofits. And I think the focus is really on how can people afford to come up here and kind of that affordability. And so we just put on our, did like an invite only for local foundations to come up here and experience the retreat center and to kind of dialogue with us. But we're kind of exploring on, because it's a topic that's coming up in a lot of foundations is, burnout in, nonprofits and leadership in lots of communities. And so we're kind of exploring this question a lot right now is, one, how do we kind of tap into those networks of foundations and even connections we have, like our founder is a donor and like in the philanthropy world. And so it's, getting people up here, experiencing the space, being in dialogue with us. And then I'm also really interested in diversifying retreats and how to kind of, and obviously a lot of that comes with affordability of retreats. And so, so interested in it, a lot more questions than answers, but something we're really exploring. And I'm much more used to being from the nonprofit side of fundraising. So it's interesting to be in a space where we have to kind of partner to fundraise because obviously we can't receive in the current format that we're in.
Great. Thank you, Andreas. Other thoughts?
Yeah, I'll share about my experiences so far professionally with collaborative fundraising. I find that I just really prefer to work this way because it feels somehow less risky and I've found that funders are more receptive to receiving. I was finding it interesting that you said that, it's difficult to get funding for networks, which I can completely imagine. But when several different organizations get together and say, like, this is something we think is important, it just seems to be a very effective approach as far as, you know, attracting funders' interest. And I don't know about you all, but as executive director at Southern Dharma, I feel like there's a lot of times when I feel quite lonely in my position. And so working with other peers at other institutions makes me feel like I'm more in community. And it also feels like it's making more sense, whatever I'm doing. So I just tend to gravitate toward these kinds of opportunities, even with their additional complexity and even with the navigating of the relationships. I just feel like there's just a lot more strength in moving forward on things where we find common ground together.
That's great to hear. Yeah. Yeah, sort of embracing the complexity because of the resilience that diversity brings. Like having that many voices in the room actually gives you more opportunities. There's more ways to approach challenges that might come up. Oh, Brian, yes.
I guess what I'm trying to wrap my head around is we have gone in so many different directions, which led to our still being here post-COVID. But also, we host lots of programs and events and groups and whatnot, but we also have what we call staff programs that we ourselves develop or develop in partnership with someone directly. And so I'm just trying to figure out the complexity of financing, because we have some programs that bring in income and others that are done on a donation basis and others that we sometimes actually spend money on because they are for the general mission of this place. We are one of those places founded by a religious community of sisters in the Catholic tradition. So I'm wondering if there is room for one particular program. I know I've mentioned it to you and others, and there seems to be some real interest in what we call Operation Restore, which is for first responders recovering from traumatic injuries and events, and very, very well researched and whatnot. But it's probably the one program that we are committed to absolutely and have been for over 10 years, but for which only half of the actual cost comes in the door. And we don't want to stop this good work. So, and I don't know how we would replicate the programming if it meant, and I'm thinking of all your charts, which by the way are very helpful in some ways to just kind of consider the thinking, but how could we partner on this program or similar initiatives that reach out to first responders and veterans, that kind of thing? Because that would be something that is a niche program in a sense. It happens every month here, but which I need funding. I'm down to zero for that particular program. So is there a way to use the connectedness, the resources of RCC around a particular cause, for lack of a better term at the moment, like first responders needs, especially with PTSD and all of those? So I'm just throwing it out there. I don't have an answer, by the way. I hope you weren't counting on one. I just, was just wondering how that might work, because there are other programs that hold their own. They bring in their own income. The groups that are committed to doing this, charge their membership appropriately to cover the costs, et cetera, et cetera. But that's the one program for which I need to have a regular, ongoing, and designated fundraising effort.
Yeah, let's jump to Dr. Nancy, who has a thought here.
Wait, there, just a clarification. Brian, did you call it coverage and resters?
It's called Operation Restore, and it's a program that we bring in both spiritual counselors as well as professionals in EMDR as a way to cope with PTSD symptoms. And it's for first responders, police, fire, and military that have had traumatic experiences in their work. Death of their partner, a child that they were unable to rescue from a fire. I mean, unbelievable stories of courage, but that leave them haunted. And happily, this program was developed 10 years ago. We now have 420 people who have gone through it.
Wow.
And with very high level of success. But it's constant wait to make sure that we don't, because I don't want this to go anywhere, but got to do something. And so I don't know if that's one area that a collaborative effort might work with, if there are folks that know of others around the country or organizations that maybe I'm not connecting with. So I'm, it's a wondering rather than, of course, an answer.
Okay, thank you. I just needed clarification.
Yeah, to me, it seems like a great kind of flagship example of how we could move into collaboration if there were alignment at 2, 3, 4 more centers who also want to do a similar program, or maybe already are. We could compare models. We could compare the funders we're already working with. Which organizations are you partnering with in your local community that need benefit from these services? What kind of funding do they have? And then can we start to scale it? Is there enough there that we have building blocks that we could scale it together to say that there is a national funder who works specifically with a certain group that could fund the 4 of us instead of Brian kind of doing it on his own each year or each whatever it is.
Yeah, because I'm thinking it's a non-denominational concern. We don't ask what their religious tradition is. We hope to have enough people and resources, and usually do, to provide them with spiritual support as well as all of the other, mental health. And I mean, we even have guide dogs that come. Southeast Guide Dogs is the agency in this area to see if that's a part of the solution that these folks are seeking. So it can be across the centers. It's not only a Catholic program. It's not specifically a religious program, although we have pastors and some Catholic priests who work in the program because of their credentials. One of whom was a chaplain for the military for many, many, many years in Afghanistan. So I'm just tossing it out. I mean, it might be something we'd have to study. What is out there? Does the Disabled Veterans of America have a program that does this? Is there something with the VA? I don't know the answer to any of those questions yet.
I'd like to turn it back to the full group. I don't want to dominate too much. I have some ideas, but but I'm curious if there are other things that are bubbling for you as you listened to the presentation, or as you're hearing Brian's kind of curiosity come up here around what's possible. Is there something similar at your center where you're like, I have a feeling that I could do this in partnership with other centers?
I'm trying to figure out how to raise my hand on the thing, but
Okay. Hi, I see your hand. Yes.
So, Brian, what you're talking about definitely speaks to my heart. On one of the reasons we founded the center is to work with specific audiences that have needs that are underserved and can't afford to come on retreats. And so all different things that veterans and that other people have mentioned, the first responders, the caregivers, cancer patients, people suffering from traumatic, any of these specific kind of things. And we don't have this at our retreat center now because we've just been growing it in order to stay, alive, because we're not the ones leading the retreats. We have facilitators that come and rent and lead the retreats. But this is definitely something that's been on my mind as a very core part of why we want to do this center, is to serve these communities. So I am definitely interested in learning more about how to do that. And part of it would have to be, we would need to have the facilitators to run these, not just the funding to get people here, but the facilitators to run these things. So that's just all I'll say about that, but it is interesting to me. So
Yep.
yes.
See some clapping. Nancy.
We have a scholarship program that offers funding up to about 25%, and on occasion we'll go higher than that. But it's definitely for specific populations. And I don't know, Eve, if that's something that you do in your retreat center or not, but that comes up to be very helpful. Like if we have any confidential groups that we would classify like AA or, groups like that, we usually figure a large percentage, for those groups. Brian, I see that you're shaking your head, so you probably do the same thing. We are sponsored by a Catholic Order of Sisters, but we function as an interfaith retreat center. That's in all of our billing, marketing materials. Enjoy our interfaith hospitality. And, but there is a grant source that we apply for every year, and we've gotten everywhere from 5,000 to 12,000 a year. That's been helpful, to apply for that. And that is through the sisters. In our case, I tend not to apply for a lot of other fundraising because we're on a campus that's the mother house of this particular Order of Sisters, and they have a full-time development office. And when I first got here 17 years ago, I was, going out doing fundraising and typical things that you would do as executive director of a retreat center. And I ran into places who said, well, we've already given to them. And there's a school here also, an elementary school. So the school's fundraising and the development's fundraising, and now you're fundraising. So we've had to work that out so that we defer to them. But when appropriate, I can apply for separate grants. But as Brian implied before, there's not a whole lot out there that will fund a faith-based organization. So in our case, we have to show, even though we are an interfaith facility, you do not have to be faith-based in order to come and benefit from what we offer. And that's where our scholarships come in handy.
Yep, thank you. I mean, there are some more layers there that you're working with within your organization. Yeah, that some other retreat centers wouldn't have to deal with that, but yeah, that's another piece in the juggling act.
Yeah, and we're all separate 501c3s. I mean,
Wow.
I'm a separate 501c3 with my own board. The sisters, they have their thing. The school has their thing. So these are all separate 501c3s. But we are officially sponsored by the Sisters of St. Francis at this particular location.
Nancy Golan at Casa Escali, got something?
I think I just wanted to circle back for a minute on what Brian was saying, is that might be a way to look at collaboration here. Just outside of Chicago, there's a retreat center that does a retreat that's called Vets for Vets. And I think it's similar. I don't know about content, but, maybe an opportunity would be if there are, retreat centers across the country that are offering that kind of program already, to kind of get a brain trust together where you're doing best practices, what's really working well, what are the different models. Like we used to sponsor that Vets for Vets retreat. It's been going on a long time. And I've seen where the team is spot on. They've got all the resources they need, and it's wonderful. And then, the ebb and flow of, I think they've been doing this for 20 years. And then other times where, they don't have a strong team and it's not, I'm sure it's still a meaningful experience, but to really think about for those, whatever those target groups are, in this case, first responders or veterans, that we could come together and create high quality programming that then could be shared, and then people could fundraise individually for the programs, but you know, I mean, that's just another way of collaborating that would be kind of sharing information, and yet, you know, maybe creating a speakers bureau, or I'm sure there's a more modern way of saying that. You know, if I want to develop a first responders program, you know, what are the best practices? What are other people doing? Who can I talk to? And maybe we'll fly some people out here. Maybe we won't, but just another model for that.
Yeah, yeah, Brian, yeah, that's right up your alley. I'd be curious, what would benefit folks the most for RCC to do in those kinds of situations? Like, what is RCC's role to bring things together? Are we doing collaborative program development and then funding for that program and sending that out to more centers? You know, what's the way that we hold that so that RCC has a role? And maybe there are some ways of collaborating that RCC doesn't have a role, that it would be, you know, these three centers really have something in common and they're going to chase it on their own and they don't really need help. We've helped create the relationship. That's what they needed. So there are multiple ways to think about it, but that's always my angle, is like, where's our place to sit? Brian?
If you could help us to reach out to as many contacts as you have, to if we gave some descriptions of programs that we have that we want to seek some funding for, find out if there are models, whatever, putting out just something for us to help us gather the information, like this Vets for Vets. It may be a close match, it may not be, but it might be an organization that could learn from, and the fact that the university nearby has done 2 studies of our program, that research might help somebody. So the thing I would appreciate would be if RCC could, you know, do some methods of helping us gather some information and facts and resources and sift through them and see what we come up with.
Mm-hmm.
Just one idea.
Kate, yeah.
Hi.
I have a,
Oh,
go
hold
ahead,
on.
Kate, sorry.
Thank you. Sorry about that. So Omega has done programs for veterans and for first responders and for cancer survivors and families of cancer patients and survivors for a long time, at, you know, in different ebbs and flows. And something that I think would be really interesting to explore with RCC is, in particular, because of your relationship with Fetzer, who is a wonderful foundation, but also a really thorough foundation in terms of the requirements that they expect from their funded organizations. Something that we have found over the years with funders is that private foundations are looking for more significant research and findings about the impact of their programs beyond, you know, numbers served, et cetera. So I wonder if that's something that we could collaborate on, so that we could take the programs that all of us already have or that we're looking to build, and try to apply some parameters to them so that we can make the best pitch. I know that one of the funders that we've worked with, really, we had a very successful program, but many of the same people were coming back over and over again, and the foundation didn't want to do that, right? The idea is that they come to the program, they get a specific skill set, decrease in stress, whatever it is, and that is enough to carry them on, because if they're repeating and repeating and repeating the program, then what's really the benefit of the program, right? So if you're trying to, anyway. And another program that we do often, but not always, that has been very successful and is very, it's easier to fund, is a particular program with a particular faculty member who provides the evaluation, so that we know at a statistically significant level what the impact is of that program. And that's, those juicy data points are things that we've found that our funders are eager for.
Yeah, well said. I can definitely see that. I can see some of what we're doing working that direction. I can see there being a lot more work to do. And also some of the challenges of doing that at a network scale. It can be really hard to measure the impact of the impact of the impact, that sort of ripple effect at all of our centers into our communities and then out from there can be really hard to measure. So how do we get at RCC the capacity to support that? That's a big lift. But I also see the value, and the value for centers who are participating to have access to those kinds of numbers to be able to each approach our funders. Sandy, did you have something?
I did. Everybody that says something sparked something, so I'm going to sound scattered, but I like the idea of your green papers. And with what Kate just said about having someone on staff that can do the evaluating, if there's a evaluation questionnaire that could be developed and shared with the group for, how do you use this with your funders? And I'm curious if you subscribe to, like, we joined Peak Proposals so we could get a $99 membership in the grant research grant station, I think it is. Is there a membership opportunity to join in together on one of the grant research websites? Because they can be like $300 to $500 a year. And I don't know if you already made that available, but
We have not. That's a good idea.
And the Peak Proposals also, then they give you webinars on how to write grants and things. But it gives you that access to the $99 a year membership. And I don't know if that's something you could do to part of your membership program to serve us all.
Mm-hmm. Great. Thank you, Sandy. Yeah, it's a good idea.
I also want to say I love that Sonia's outside for all of us.
We have about 10 minutes left. I think it might be an appropriate time to move to like a next steps kind of piece of the discussion. And Sonia, I'm wondering if this is a chance too for you to speak a little bit more about what we've talked about in the past, about some ideas of where this conversation could go. If we wanted to, I don't know, some of what's been expressed has been much more focused in terms of a specific topic or program, but there's opportunities to have another conversation too.
Yeah, what I had proposed to Ben and Aaron and the RCC was just whether it might be interesting to have I think what we're calling a collaboration hub around fundraising. And for me, the most immediate reason for that was just that I recognize that I have, while I have a lot of experience in this area, I also have a lot of growth, that is possible. And I'd like to hear more about how our other organizations handle, even platforms and tools that they're using and this kind of stuff. So it's really a lot less, my concept for this was in a way a lot less ambitious than what we've been talking about here today, but I'm interested in all of it. And I'm, I would be willing to try to be of service to this community by, convening conversations or facilitating sessions if we thought that was something that was worthwhile. And I'm really very open, but just to be clear, it was really very kind of pragmatic, kind of skill sharing, the usual RCC stuff about peer-to-peer support and sharing of information and experiences and tools.
Yeah, which is great, that's part of why the folks who are here are on this call. We're curious about that. So that's what RCC does. I think what I might do is have folks email me if that sounds like something they're interested in, and I can send out a note to folks from this call, maybe even to folks in general, about a possible conversation, 2 conversations, 3 conversations. Continuing this thread, community calls tend to go from topic to topic over the course of the year. So we may not talk about fundraising again for several months in this forum. But if there are folks who are interested in continuing on this thread and in going a little deeper with the support of some sort of gentle facilitation from Sonia, that would be great. And if there's some things that come out of that, like some of the ideas that we've already sort of broached today, there may be more support that RCC can do to dive into those. We're also Aaron and I are trying to navigate our capacity as well. How many more things can we, how many more emergent processes can we open up that are going to grow into something that we can't actually hold on to? But there's room right now for us to do some more exploring. So while we have capacity, we'd like to see what's there. So I put my email in the chat. If that's something that you're interested in, I encourage you to just send me a quick note. I'd like to talk about collaboration in a collaboration hub or in a group. And we can start to look for some times to hold that conversation. I also, I just want to thank Sonia for kind of throwing it out there. Like, hey, I want to talk about this. I like this topic. That doesn't happen all the time. And so that's really special. So thank you for, yeah. And I would say I really appreciate, Brian, you being just kind of so forthcoming about the dynamics of that one program and trying to get the funding for it and how it's been really successful. You've got research around it, and many other folks chiming in and saying they have, or, they have neighbors who have similar programs. So part of my presentation today is to give us a little bit more of a framework of how to move deeper into a collaborative process around that, like where I actually make an agreement with Franciscan Center Tampa that we're going to pursue some funding to see if we can scale this out. So that's a conversation that Brian and I can have. And then maybe some other folks want to have too, about their programs for vets or for folks who are recovering from trauma of various kinds. Or we can see where there's overlap and where maybe a broader agreement can be entered into. So that when I'm doing my little research in my office here in Michigan for your center, I know it will actually go somewhere because I know that you're interested in it and we have an agreement about where we're headed. So that's what I'm working toward. Other thoughts around that? Have I made those points clear? Are there other kind of fuzzy spots that I haven't talked about? Maybe I did my job, right? I'm still holding the joy of those games outside, the stories from childhood, the sweetness of spring. So thank you for sharing those stories with me, with your community, with this video. Thank you, Aaron, for saying, hey, can we record this? Yeah, I'm glad we caught that. Our next community call is going to be on the 25th. We're going to talk about ways to engage your community members that maybe aren't as active, like your volunteers or your program alumni. I don't have the answers to those questions, but we all do together. So that's going to be one of those peer support calls where we learn from each other. So I'm looking forward to that conversation on the 25th. Thanks for being here. And I'll see you next time.
Thank you.
This has been wonderful.
Good. I'm so glad.
Thank you.